Hi, my name's Manoj Krishna. I'm a spine surgeon, and today I want to tell you a story about a patient of mine who had a disc prolapse in the neck. This is a 42-year-old gentleman who presented with a big disc prolapse, as you can see on the green arrow, and it was causing severe pain in his right arm, and his index finger was stuck and not working. On a cross section, you can see how the disc has come out on the right side, and he was in really severe pain for a long time before I saw him. So we treated him with an anterior cervical decompression and disc replacement. There's a transverse scar across the front of the neck. Here you can see a metal-on-metal titanium disc replacement that goes in to the disc space. And the surgery takes about 45 minutes and he's in hospital overnight. Here's Mark telling the story.
Good morning, Mr. Krishna.
So, speak up a bit. So, how old are you?
I'm 42.
Okay, and what sort of work do you do?
I own and run a construction company.
Okay. So tell me a story about this neck problem and how it started, and it was pain down your arm. So
I was in the gym one morning and I bent down to pick a bar up. Somebody had come by. I'd not picked the bar up at this particular time. Somebody had walked by and said hello, and I turned my neck, I turned my head, and I felt and heard the click.
Okay.
And I just thought to myself, that'll be painful for a couple of days.
So it was just turning your head to one side?
Turning my head to one side,
yes.
And quite gently, and I just thought that'd be painful for a couple of days. It was on the third day when I'd woke up, I couldn't move. I couldn't turn my neck, and the pain was just in my neck at that point. As time went on, I just thought it would go away, as people do. It got worse. The pain started then going down into my shoulder, down into the back of my arm, and into my hand. And my hand gradually started to go numb.
Okay.
I went to the chiropractors a couple of times, and that didn't do anything. And near the end, before I came to see you, I was in the shower, I was washing my hair, and I had my arms up, and it just went again, something went again, and I couldn't move. And we had to go to the York Hospital, the ambulance had to come out, my wife called the ambulance. So the ambulance took us to the York Hospital. They couldn't see anything particularly wrong. So we went, and then 2 days later, I woke up in bed about 12 o'clock in absolute agony.
And by then your right index finger wasn't functioning?
No, it was numb, it was stuck out.
It was stuck like that, wasn't it? You couldn't bend it at all?
I couldn't bend it, I couldn't move it, I couldn't feel it, I couldn't feel the back of my hand. And we went back to the York Hospital, where my wife insisted that they do an MRI scan because there's obviously something not right, and they did. And that's when we realised that mid-disc 6, C6.
C6-7, there's a large disc out, pressing on the nerve.
Slipped onto my spinal cord.
That's right, it was pressing on the nerve.
Yeah. So, from
but
there...
by then you've been in pain now for...
6 or 7 months.
7 months,
yeah.
okay.
I mean, the latter 2 months was... We couldn't go out for a meal. I couldn't sit at a dining table. I remember over the Christmas period, I couldn't sit and have my Christmas dinner. I had to keep getting up, and most of the time I had to sit or walk with my arm in this position,
right,
because that seemed to
give some relief.
Yeah.
So you had a couple of trips to different hospitals, but eventually you came to me and...
came to you on the Wednesday. We had a chat.
We looked at the scan?
Looked at the scan. It was quite a nice calm chat. And then obviously off I went, and then on the Thursday morning I came into the office after a meeting to find that you'd made an appointment for me on the Saturday.
Yep.
Of course, then I was a little bit anxious.
So I suggested a disc replacement at C6-7.
Yeah.
And you've had the surgery now about a month ago.
Yes.
So let's have a look at this scar, because you can't hardly see it. Yeah, there you are. Yeah, thank you.
Yeah.
So tell me about the surgery, your recovery from it, and so on, and how you are.
Well, the there's not a great deal to tell because it sort of happened so quickly.
But we could have started by saying you were really anxious about surgery.
Oh, hugely.
And you've also got a phobia of needles.
Hugely. Which I think might have been... we might have quashed that phobia now, I think. Because I've had that many needles put in me. But yeah, I was very anxious. We drove up on the Saturday morning from York up to Teesside. And I think probably what helped was the surroundings. We went into our room. My wife was with me. We watched a little bit of telly. And everybody was pleasant in the hospital. So that sort of eases you a little bit. And I think the biggest thing was just probably going into the pre-op room and having the needles, because that was the phobia really. It was all good.
Yeah.
It was all good, you know, and then 2.5 hours later I woke up. And it was fine. My wife came to see me came back about 3 o'clock. Had a reasonable day as what you could have.
And when you woke up, was the pain in your arm still there, or was it gone?
No, it wasn't. It was almost immediate that it left. My finger was still numb, and the only discomfort that I had was just obviously where you clamp my head back on my neck, and that was just a bit sore.
Okay, so you went out of the hospital on Sunday.
Sunday.
And then what happened on Monday?
I went back to work.
Now that's a record, I think, for most patients. I wouldn't say that that's the norm for everybody.
I wouldn't advise that, by the way, if it doesn't feel
Most
right.
people take a little time, but you went back to work on Monday. But
Yeah.
it just shows that it's possible to do that.
I felt with the pain that I was in for the past 7 months, and especially the latter 2 months, the pain had gone.
Yeah.
And it was almost instantaneous, you know, and it was a great. If having an operation can be a good experience, then this particular.
Okay, so you're a month now from surgery.
Yeah. Yeah.
And how much pain do you have now?
None. No pain whatsoever. I've not had pain for probably about a week after. The only pain that I had after, as I said, was just the aches from actually having the operation. The pain that I was experienced before the op due to the disc had all gone.
It's gone. And show me your range of neck movements. Pretty impressive, I think,
Yeah,
for
okay.
4 weeks. Okay. Okay, that's excellent.
So I'm now back at the gym, gently exercising, and
You played some golf?
started to get the golf clubs back out again, and that's okay.
When did you start driving after surgery?
2 days.
2 days.
2 days. My wife drove me for the first couple of days, but then I came off the pain relief on the Tuesday because I didn't need it, and I'd had that much pain relief prior.
Yeah, how many tablets were you taking before? What were you taking?
Oh, I was on Oromorph, Tramadol. I can't remember the tablets. Was it Tramadol you gave me? I can't remember.
Yeah, and then gabapentin.
Gabapentin. I was on about 3 or 4 different types with the Oromorph.
Yeah.
And then I had the painkillers after the operation, and then we had painkillers to take back, which I took for, as I said, till the Tuesday, and I think my body was just soaked with painkillers.
So it must be a relief to be off all the
So it was
painkillers
off-
too.
That was yeah. I made the decision on the Tuesday night, sort of Wednesday, that I wasn't taking any more painkillers. I didn't think I needed them. The scar didn't have any pain. The other thing I was quite anxious about was taking the staples out, and that was just
Straightforward.
didn't even feel a thing.
Mark, thank you so much.
Thank you, Mr.